Okay, this video is about stress. Stress is probably your #1 enemy. It's gonna be your #1 enemy. Not the difficulty of the didactic classes, the clinicals, the professors. I think it's going to be stress. The successful nurses, in my opinion, all the ones that succeeded, that passed NCLEX, have become RNs, made it through the programs. They say that was the hardest part. It wasn't really the test taking, whatever. I mean, yeah, it's hard, but they stressed them out more than anything. And from what I gathered from, and I didn't conduct an extensive interviews process, but you know, I talked to people who got out, failed, came back in, failed and never returned. Those are fewer far between that I was able to talk to. You just don't talk to them anymore. It still was stress, but the ones that didn't can come back. A lot of them was a question of the schooling and what have you. So that's maybe the cutoff. And what I mean by that is changing their way of thinking. This is what I just spoke with my daughter about stress and schooling. She's going to nursing too, and she's kind of fighting and resisting it, changing the way she wants to think, because nursing school is there to change how you think. You have to change. They're it's like Marines. They tear you down completely and then repopulate that personality with a fighting machine. That's what they want. They want independent people that can think in a scenario and continue, not just drop the pieces. They want to continue on. Same thing with us. It's a question of, if something happens, we want nurses to be able to respond and think accordingly. This is another video I think I'm going to post before this about critical thinking. I had a disagreement with a nurse about carrying out orders. I said, no, use your critical thinking. Yeah, you're used to doing that because you're from that kind of unit. Critical thinking for here requires you to sometimes not ignore the order, but to not carry it out. It's like parameters for high blood pressure. If the blood pressure is too low, you don't give the med, right? They're setting those parameters out for you. The scenario where I think she disagreed with me was more founded on the fact that I didn't notify the provider right away, but it wasn't like notify the provider. It wasn't even written in there. But it also wasn't an emergency situation. It wasn't like, oh my God, she's not, we're not doing this, you got to notify. No, it's like, oh, she's not doing that. It's an improvement. The provider will see it, or I'll talk to you, the day nurse. You can notify them. She was like, well, you didn't notify us. I am not going to contact the night hospitalist to give them good news. That's ridiculous. They will rip my head off for that. Especially the night in question, they had like 3 codes. They ignored some of my communications, actually, for other things that I actually needed, because they were in the middle of code. I don't blame them. I said, oh, okay, I can handle this. I can hack this. It's not horrible. We have meds coming up. They're timed. I'll pull them up front. But to give them good news? Are you serious? Or just to tell them status quo, we'll continue to monitor, they will continue to kick my ass? No, that's not what you do. She had a resident on call in their unit all the time, and if that resident leaves, another resident will take that place. There will always be someone on call. I don't live in such a fantasy land. No. I mean, there are worse places, don't get me wrong. It's like nursing homes. It's just whoa, holy crap, right? That's horrible, and something we need to deal with in our society. But critical thinking is something we need to get taught. You need to change that. And that's why my daughter's an EMT. Some of that I'm hoping changes, and has changed her way of thinking. But she's thinking like an EMT, which is different than an RN, unless you happen to be a flight RN or a ER triage nurse. you know, or maybe an OR nurse, because things happen extremely quickly there. So those scenarios might be a little different. So she's thinking a little differently. I have to tell her to change her way of thought, and she knows that. She's like, I don't want to change my way of thought. I say, you have to, you know, and it's a slow process. They know it's not going to happen overnight. And I think a lot of people can't change that, and they fail out. That's one. Stress, and it's stressful for her right now. Stress, I'm sorry if you guys hear that noise, it's raindrops. It's the stress of the program. It's the stress of failing out. You know, she just kind of realized, she was like, oh wait, you fail out, you can't get back in. I was like, yeah. If you're 2 points under, you can apply, and it's up to them. And now in this scenario, this day and age, I think they would take everybody who was in that range. But if you're 3 points down or 2.1 points down, bye, start all over. So you're working without really a safety net. And that's kind of scary versus college. You could always take a class over, you know. Yeah, I didn't fail, I withdrew, you know. Here you withdraw, you have to apply to get back in. And they say yay or nay. And again, in this day and age, they will say yay. So we're in such dire needs. You know, in my other video, I was saying we were not just short-staffed, we were half-staffed. So we are in desperate need of nurses, good nurses. They're not going to lower the standard to let you guys in. They will still train good nurses, will still train and teach, you know, very well. You know, and you will be taught very well to handle the situations, because there will be times when you're on your own, and what are you going to do? You know, there are times when, you know, I'm on my own, and what am I going to do? You got to think, and you got to think for the patient's safety and their survival, and think of another way if your ways are blocked, okay? And that's what critical thinking is about. You can handle the stress. Don't worry. You know, you've gotten this far in life, believe me. And I to say to my daughter, it's just a year, 2 years, whatever. It's a few semesters, and you're done. And then you work, and that's a whole nother level of stress, but it's a different way. This is just stupid stress. You'll get through it. You get stronger as you go along, you know. So again, Rome wasn't built in a day. You guys give it patience, hang in there, build on your strength. The stress is just going to make you stronger. Okay? Good luck.